Hi everybody, it's Adam with HeartValveSurgery.com. We're here at the Heart Valve Summit in Chicago, Illinois. I'm thrilled to be with Dr. Rawn Salenger, who's the Director of Heart Valve Surgery at Good Samaritan Hospital in Suffern, New York. Just so you know, Dr. Salenger has performed successful surgery on many patients in our community, including Kathleen Ryan and Jean Beauvais. And we got a question, Dr. Salenger, that came in from Anne. And she says, how long can a patient expect to feel their heart beating so strongly after heart valve replacement surgery?
Well, that's a very common question. I get that a lot. And what I tell patients is a lot of times after surgery, they can, especially when they go to bed at night, they may hear their heartbeat or even kind of feel it in their head. And that sensation will go away after. It's very individual, but after about 8 to 12 weeks, and sometimes much sooner. I think what it's from is after surgery, there's fluid around the heart, and that fluid tends to amplify the sound of the heart beating and also the feeling of the heart beating. But as that fluid solidifies in the scar tissue, instead of amplifying the sound, it actually deadens the sound a bit, or softens the sound, and that should go away. One exception to that is a slightly different question that comes up occasionally about for patients who get a mechanical heart valve. And they don't hear their heart beating, but every time their heart beats, they can hear the open and closing of the mechanical valve. It doesn't happen for every patient, but it happens commonly, and it doesn't mean there's nothing wrong with the valve, but it's something that, especially at night when things are quiet, patients can hear. And usually people get used to that, and it shouldn't bother them at all.
Yeah, I can remember personally, my wife could hear my heart when I was sleeping shortly after surgery, and she said to me one night, I can hear your heart.
And how long after surgery was that?
That was about 2 weeks after surgery.
Yeah, I think I find I get that question a lot, just about 2 weeks after surgery, and then I haven't heard anyone where it persisted.
Yeah, great. Well, Dr. Salenger, thanks again for being with us today. Really appreciate it. Keep up all the great work that you're doing at Good Samaritan Hospital. And again, thanks for stopping by.
Thanks for having me.